Another chest x-ray, and have a good look at this chest x-ray in different window level settings. And you don't have to look too closely to tell that the x-ray was taken in erect position and is grossly abnormal. From radiology point of view, hardly any part of both lungs can be classified as normal other than this area and this bit, probably here as well. The X-ray shows countless cysts of varying sizes visible through both lungs. So this is a cyst here, this is a cyst here, this is a cyst here, a big one here. Some of them are a small cyst, this one here, and they are countless. Some of them are visible through retrocardiac area here. Notice some of these cysts, such as this one and this one and this one here, appear to have air fluid levels, and that is the reason for us to believe that the X-ray was taken in erect position, either standing or sitting. If the same patient was to be X-rayed in supine position, you would not see these air fluid levels. A fluid level is simply an interface of air and fluid in a cavity or in a confined area. In erect position, fluid falls towards the gravity, and air, being lighter, rises up, creating such straight lines, such as this one, known as air fluid level in radiology. In supine position, the fluid will still fall towards the gravity, means towards the back of the patient, and air will still rise up, but you will be looking at these cavities from top, so the fluid levels will not be visible to you. Some of these cysts, such as this one, appear to have crescent opaque inferior borders. The rest of such cavities above this crescent border, you have an air density, so rest of the cavities are filled with air. Now these cysts are actually dilated bronchi rather than anything else. The condition, if not confined to limited areas of lungs, can be deadly and is known as bronchiectasis. Bronchiectasis by definition is a permanent and irreversible dilatation of bronchi. As a result of dilatation, bronchi lose their ability to clear mucus. Accumulation of mucus within dilated bronchi causes frequent infections only to worsen the condition of the patient. Please note that normal diameter of trachea should be between 21 to 27 millimeters in adults. Right and left main bronchi should be much smaller than trachea in a healthy person, and the branches of bronchial tree should get smaller and smaller in size as they divide. Even each bronchial branch should taper at the distal end. In this case, notice some of these dilated bronchi are bigger than the trachea itself. There are three forms of the condition known as cylindrical bronchiectasis, varicose bronchiectasis, and cystic bronchiectasis. And what is in front of you is known as cystic or saccular bronchiectasis. As you can see, multiple cysts or sacs. In cystic bronchiectasis, many large dilatations of bronchi end up in big and small cysts that may get filled with pus, blood, and mucus. So what you're seeing here is a thick crescent line is actually thick pus which is falling towards the inferior border of the dilated bronchi, which is like a cyst in shape. In other cysts, where the fluid may be a bit watery, you can see air fluid levels. Any disease or condition that can damage the bronchial wall repeatedly may cause bronchiectasis, and it is not limited to an age or gender. Even young children can have bronchiectasis as a result of just one bad viral or bacterial pneumonia. Almost a dozen diseases and conditions can lead to bronchiectasis, but most frequently it is associated with any previous infection such as viral or bacterial pneumonia. Viral pneumonia, especially in young children, and once a child has bronchiectasis, it becomes a continuous headache for young patient as well as parents, as it causes pneumonia frequently. Cystic fibrosis is another condition which is a result of faulty genes that are transmitted from parents to children. People with cystic fibrosis can have bronchiectasis very frequently. Tuberculosis is another condition. Histoplasmosis, which is a fungal infection, and allergic bronchopulmonary aspergillosis, which is associated with asthma. Measles and AIDS are also one of the conditions that can cause bronchiectasis. Although the X-ray that we are seeing here is a very good and classic example of bronchiectasis, but plain X-ray is not an ideal tool to make this diagnosis. Only severity of this disease in this patient is making the condition visible on this X-ray. Very frequently bronchiectasis cannot be seen on chest X-ray, and investigation of choice is high resolution CT scan of chest or HRCT. And as you know, CT is a cross-sectional imaging anyway, and the sensitivity is much better than plain X-rays in any case. So here is a close-up of right lower zone of lung. You can see countless cysts, some with fluid levels. This is the small one. This is the fluid level. The mucus or pus or blood is accumulated towards the bottom of the cyst, and the thin cyst wall is actually visible at the top. And these are also dilated bronchi. Axial HRCT image, and HRCT would be suggestive of bronchiectasis if the internal diameter of a bronchus is visibly and significantly larger than the pulmonary artery branch in the same bronchovascular bundle. So this is the bronchus, and this is the pulmonary artery, much smaller than the internal diameter of the bronchus. Now the wall of the bronchus may be thick to indicate the inflammation of bronchus, but you have to measure the internal diameter of the bronchus and compare it to the pulmonary artery, which is in the same bronchovascular bundle, and it should be visibly and significantly larger. The bronchus should be significantly and visibly larger than the pulmonary artery. If you look closely, the thing looks like a ring, a signet ring, a magnified view. So this is a sign which is known as signet ring sign on CT scan. Another one here, but in this case, see the diameter of the pulmonary artery and the diameter